People come to me for chiropractic. They may be coming to me for nutrition. They may be coming to me to help their brain get into better balance, or some people know they need it all. And through my journey of having to figure out myself, I am able to help you in a shorter amount of time. We cut to the chase. I am able to get you started on your personal healing journey much quicker because I've figured it out. That's what I'm known for. And this is why people in the Valley call me the Valley's holistic detective. Your health gives me clinical clues, and it intrigues me and it interests me because I don't want anyone ever to go through what I did and to feel hopeless and not know where to go. So I hope that I get to meet you in person, and I hope that I have the privilege of helping you on your journey. Hi everyone, I'm Dr. Mikell Parsons, founder of the Natural Path Health Center, and welcome to my website. As you can see, we provide a lot of different services, and I wanted to share with you how that came to be. So when I was a little girl, my whole dream, passion, focus was to become a dancer on Broadway. That's all I wanted to do. And as soon as I started dance classes, I was all in. Until a fateful day when my family and I were water skiing up at Pine Flat Lake. And at the age of 16, my ski hit a submerged tree stump. I didn't see it. I didn't anticipate falling. But when the scag of my ski hit that stump, my foot got shoved deeper into the ski and it threw me 3 times. I rolled 3 times to my right and then bam, landed on my face. I have a vague memory of thinking, you need to turn over on your back or you're gonna drown. I don't know when the ski came off. My dad brought the boat back around and he had to physically pull me into the boat. And by the time I got home, I could not stand anything touching my right side. I couldn't put any weight on my right leg. I was hunched over. And when my mom saw me, she said, "You're gonna need to go see a doctor." And in my 16-year-old brain, I said, well, who is not gonna give me a shot? Because I don't wanna go to anyone who gives me a shot. And she said, well, your choice is the MD or a chiropractor. The MD, you might get a shot because you're seriously injured. The chiropractor doesn't give shots. And I said, well, I don't know what that is, but I'm gonna go to that chiropractor thing. And I started as a patient for really the rest of my life. But for that initial injury, I started seeing my chiropractor, and I was blown away that the body had this power to heal without drugs, without surgery, without any of what I perceive to be those scary things that can happen when there's serious injuries. And I began my road to recovery. During this time, that amazing chiropractor kept saying, you should be a chiropractor, because he saw my interest and he saw my fascination. And my reply was, I'm not smart enough. Next visit, you really should think about becoming a chiropractor. I don't have the money to go to school like that. On and on and on until next thing you know, I'm in chiropractic college and I am loving the learning. All of a sudden, I started to develop left knee pain. And it would come randomly. I would be great for weeks, and then I wouldn't be able to put weight on my left knee. It would be swollen. So I started going to see different chiropractors, different sports medicine doctors. We did imaging, and everyone said the same thing. We don't know what it is. There's nothing overtly wrong with it. Good luck. I'm sure you'll figure it out. I then graduate, and I happen to be at a technique seminar. And in the course, the instructor said, does anyone here have any knee pain? And I'm like, pick me, pick me. Because in my mind, I was in my late 20s at that time. I was already trying to figure out, can I adjust people on crutches, or can I do things in a wheelchair? Because when this knee pain would flare up, I was down for the count. And the instructor brought me up, and he's doing his thing, and he leans over in my ear and he whispers, "You've never injured your left knee, have you?" And I said, "No, I injured my right one, but I've never injured my left." And he said, "This isn't an injury. You're not a good example of what I need to teach. But in a couple modules, we're going to talk about food allergies. I'm going to bring you up then." And I'm like, "What? Okay, whatever." Few modules down the road, he brings me back up and he's doing his technique and he said, "You're allergic to wheat." My first thought was, "You're crazy. Like, how do you know that? You didn't do any blood work." So I go back to the office and I'm implementing the things that I've learned, and I'm starting to realize that up until then, my diet consisted of junk. It's embarrassing. My nickname in chiropractic college was the junk food queen because I lived on Pepsi and donuts and popcorn and unhealthy things. And in the back of my mind, I kept hearing him say, "You have a wheat allergy." And I realized that this was a crossroads for me because I'm either going to stand in integrity and ask potential patients, "You need to make a dietary change," or I'm not. And I realized that if I'm going to ask people to do things, I need to be willing to do them myself. So I eliminated gluten, and I have never had that knee pain ever since. That caught my attention. That opened up my mind to be willing to start to learn more nutrition. And over time, I started to change my diet. I was getting healthier. Everything was fantastic. I was off of wheat. And this was back when there were no alternatives. So it was not a sexy, fun food life, but I wasn't getting the pain. Down the road, I become pregnant. I'm going to start my family. And I miscarry. From that point on, my life took another turn. I became fully blown menopausal within 6 weeks. I had an undiagnosed thyroid condition that I never knew I had, and my health started to decline. I developed this autoimmune condition. I literally had a rash from my jawline all the way down my body. I had pain in my hands, and I started to go from doctor to doctor to doctor, looking for help, holistic, medically trained. It didn't matter. I was so desperate for help. And they all said the same thing. "You're eating right, you're trying to exercise, you're doing the right thing, you'll figure it out." Which got me really angry because at that point, if I could have figured it out, I would have. But I wasn't getting help anywhere. So I delved more into nutrition and functional medicine, and I uncovered that I had a high mercury, arsenic, and lead toxicity. And I had to create a program for me to help safely deal with that. Get back on track, feeling better, life is grand. I'm getting into cleaning out my kitchen one day and I bumped my head on a cabinet door that was open. No big deal, didn't knock me out. I felt it, and I started to notice that my memory was becoming fuzzy. And if someone were talking to me, I would start to doze off in the middle of a conversation. And I happened to be studying for my chiropractic neurology boards then. And it was getting worse and worse. I was starting to fall asleep every time I was driving. I was thinking, if this is going to be my life, I'm going to have to close my office and retire, because I had zero quality of life. I felt flat. There were no highs or lows. It was just flat. And I remember my study partner at one point, she said something to me and asked me to repeat it back, and I could not remember what she just said. And she grabbed my shoulders and she shook me and she said, "Mikell, where are you? We need to get you back." And I said, "I don't know what to do. I don't know who else to go to." I happened to be required to go to a conference, and I saw this booth with all these people around it, and I just kept gravitating towards this booth. And I was there at every break, before the show started, after, and at the last day of the last break, the woman who was running this booth came to me and said, "You've been watching me all weekend. Why don't you sit down and let me do a treatment?" And I'm like, "All right, I don't know what all this is, but okay." And she sat me in the chair and she put these sensors on my head, and I'm looking at this computer screen, and she said, "Do you suffer from anxiety or depression?" Now, she asked everyone that whole weekend. And when she asked me that, I realized I feel nothing. I don't feel either one of those, but I guess if I had to pick, I guess it would be anxiety, because I'm a little bit of a type A, like to know stuff. And she does her little computer programming, and this graph comes up, and she grabs my arm, and she looked at me and she said, "Oh, honey, I am so sorry." And she started to describe everything that I'd been feeling. And I knew she didn't know me. I knew she hadn't talked to any of my friends or colleagues, because I was stalking her all weekend. And then she started to describe the neurointegration therapy. And that technique and therapy is what got me back on track again. And I literally got my brain back into balance. I was back in action, ready to roll. And I brought a box in from my garage, and I was going to pack up the equipment to take it home to put it back in the garage, when I felt that God said, "Other people need this." And my first thought was, I don't want to do this. This is not part of my practice plan. I'm fine, I'm good. And I just felt very strongly that this was something that I needed to add into the practice. And in my foolishness, I said, okay, if I'm supposed to do this, send me 2 head trauma people, which I never got back then, ever. So I thought, there's no way this is going to happen. And within 2 days, I had 2 new patients with a head trauma history in the office.